Today's topic is plasma proteins. We'll discuss about the origin, variation, and functions of plasma proteins. First of all, we shall understand what are plasma proteins. These are the proteins that are present in plasma and mainly include albumin, globulin, fibrinogen, prothrombin. The total plasma protein concentration inside the body, it is around 7.4 gram per deciliter. So it ranges from 6.4 to 8.3 gram per deciliter. About the origin of plasma proteins. During the embryological stage of development, the mesenchymal cells they form plasma proteins. And albumin is the first protein to be synthesized followed by other plasma proteins. But in case of adults, fibrinogen, prothrombin, they come from liver. Albumin also comes from liver. Globulin from liver, spleen, bone marrow. Whereas the immunoglobulins, these are synthesized from plasma cells or B lymphocytes. Now the primary constituent of all the plasma proteins, it is albumin. Globulins have three fractions: alpha globulin, beta globulin, and gamma globulin. Alpha globulin, it comprises of alpha 1 and alpha 2 globulin. Alpha 1 globulin has alpha 1 antitrypsin, transcortin, thyroxine binding protein, and alpha 2 globulin has haptoglobin and ceruloplasmin. Beta globulin, it is composed of beta lipoprotein, plasminogen, transferrin, whereas gamma globulin forms immunoglobulins or antibodies. Now, there are certain conditions in the body where these plasma proteins they get altered. Increase in the plasma proteins, the term is called as hyperproteinemia. It is seen in case of dehydration, diabetes insipidus, hemolysis, excessive vomiting, inflammation, multiple myeloma, and leukemia. Opposite to it is decrease in the plasma protein concentration. The term is hypoproteinemia. And it is seen in case of pregnancy, starvation, malnutrition, malabsorption, damage to the liver, hemorrhage, excessive burns, and whenever there is inadequate protein synthesis inside the liver. So this is about increase or decrease in specific proteins. Like albumin, it is increased in case of dehydration, cardiac failure. Globulin, it is increased in case of old age, pregnancy, excessive tissue destruction, leukemia. Fibrinogen, increase in case of pregnancy, menstruation, malaria, tissue injury, acute infections, physical stress. Albumin is decreased in case of pregnancy, fasting, malnutrition, liver disease, burns, hemorrhage, fever. Globulins are decreased in case of hypogammaglobulinemia, nephritis. Fibrinogen is decreased whenever there is severe hemorrhage. Certain congenital causes are also there like afibrinogenemia, liver diseases, fibrinolysis, carcinoma, prostate. Now about the Ag ratio. What do you understand by Ag ratio? It is albumin globulin ratio. Normally it is 1.7:1. But this ratio it gets altered in case of liver diseases where albumin it falls but globulin remains normal. It gets fall in old age, increased globulin, pregnancy, there is alteration of plasma proteins. So these factors they alter the Ag ratio. This ratio it can be used as an index of the disease state, but it cannot be used as a specific marker for the disease because it doesn't indicate which specific proteins are altered. Now about the functions of plasma proteins. First function is maintenance of osmotic balance. Main contributor towards this function is albumin. Plasma proteins they exert an oncotic pressure of around 25 mm of Hg across the capillary membrane because they are unable to cross the capillary membrane. And number of solutes, it is a very important term, number of solutes in the solution they determine the oncotic pressure. Now why albumin is considered as the main contributor? There are two reasons for this. First is its plasma concentration. It is twice as compared to that of albumin. Okay, plasma concentration of albumin it is around 4.8 gram per deciliter, whereas plasma concentration of globulin, it is around 2.3 gram per deciliter. Second reason is it has more number of particles per gram of weight. So these are the two reasons why albumin is considered as the major contributor for osmotic pressure maintenance. Second function is blood clotting. Coagulation factors are factor number 2, 7, 9, 10. These are the proteins which have a major role in blood coagulation. But main contribution, it is by fibrinogen, which acts as a precursor to fibrin in hemostasis, and prothrombin. Next function is maintenance of pH. Plasma proteins, they act as efficient and excellent buffers. Here also main credit goes to albumin, and it is because of their amphoteric nature. Okay. And they contribute to around 7% of the buffering capacity of blood. Next function is the defense mechanism. Gamma globulin fraction and complement system, they protect the body against the invading pathogens. Next is attributed to maintenance of viscosity. There are two plasma proteins that mainly contribute towards this function, fibrinogen and prothrombin. Why these two? Because of their asymmetrical shape. They contribute maximum towards blood viscosity, and viscosity of blood, it determines the peripheral vascular resistance, which in turn affects the blood pressure. Next one is the reservoir action of the plasma proteins. Plasma proteins, these are used by the body when there is prolonged starvation, there is decreased dietary intake, and if the body is in hypercatabolic state. Next action is the transport action. Plasma proteins, they act as vehicles for the transport of several substances. Okay, so this permits only a limited amount of substance to be freely available for the biological action, and the renal excretion of the substance, it also gets reduced by binding to the proteins. Here are a few examples that you can see in the table. Thyroxine binding globulin, it transports thyroxine. Transferrin transports iron. Albumin transports bilirubin. Ceruloplasmin for copper. Haptoglobin for free hemoglobin. Transcortin for transport of cortisol. Now these plasma proteins, they can be separated by electrophoresis, salt precipitation method, and ultracentrifugation. Now in case of electrophoresis, the proteins, they behave like anions in the alkaline solution, and they behave as cations in the acidic pH. So that was a description about the plasma protein. In the next lecture, we'll be discussing about hemoglobin. Thank you.